The COVID pandemic has been an extremely humbling and learning experience of a lifetime for me. It has taught me how many problems facing us can only be fought collaboratively, strategically, and with years of meticulous planning and execution. That we really need to get our priorities straight, both as society and as individuals, and focus on what really matters. It has also proved to me, and hopefully to others, how important purpose and dedication is to getting things done. Without NGOs and frontline healthcare workers, can you really imagine what kind of a crisis we would have been in the middle of, either from a humanitarian perspective or on the healthcare front? And yet, how does society treat these professionals? We have a long road ahead, and the social sector will have to play a pivotal part in rebuilding society. I don't really have all the answers to how it's going to do this, but I do know that it's going to rise to the challenge. It will have to do so by reshaping itself along the way in service of those that it serves. I wish everyone in the social sector the very best on this long journey. Thank you so much.
The Michael and Susan Dell Foundation committed $100 million dollars towards its response to the current COVID crisis. As we were planning the deployment of these resources, there were a few observations and learnings from the environment that were clear to us. The crisis had come unannounced. We did not have the time to prepare for vaccinations, for treatments, or even the lockdown. So our response needed to be speedy. We did not have the time to overthink or overanalyze solutions. We decided we need to lead with our strengths and the experience of working on the ground that we've had for several years, and to actively collaborate with other partners who bring in complementary expertise and experience. So, collaboration was key, speed of response was the other core element. And the third element, I would say, is a strong focus on the low income communities that we serve. To begin with, we committed $20 million towards the Therapeutics Accelerator that was set up by the Gates Foundation and the Wellcome Trust, both of which have significant expertise in the healthcare sector. Closer home in India, we leveraged our own work in the livelihoods and the financial inclusion space and collaborated with a few funders to help set up two funds that would support low income gig workers as well as the micro and small enterprises. In the area of education, again, backed by our own experience, we collaborated with several edtech companies to provide products and solutions to the low income government school students. More recently, we've committed support to the Action for COVID task force that was set up by the VC community in India, trying to see how technology can help us find scalable solutions for testing, tracing, containing, and even treating the virus. Across all of these, I would say collaboration has been a key element. One says a crisis unites people and then divides them. Clearly, we are in stage one. The level of active participation and collaboration that I see across the ecosystem, whether it is the government, the philanthropists, retail donors, private sector, nonprofits, social enterprises. I think everybody has come together to address the crisis. It's a moment of connectedness. And as we move forward, I really wish we can continue this connectedness, continue this journey, look at our key areas of healthcare and livelihoods, and together address the crisis.
Our purpose as Omidyar Network India is to support entrepreneurs in the private, public, and non-profit sectors who help create a meaningful life for every Indian. In light of the current situation, as a first step, we moved quickly to focus on the health, safety, and well-being of our own teams, and the continuity of operations that brought about enabled us to significantly step up our responsiveness to our partner organizations. What we've also clearly learned is that the financial distress to large sections of the population, daily wage earners, migrants, etc., is severe, with the lockdown resulting in the cessation of most business and work activities. A survey that we supported in the last few days shows that additional direct benefit transfers, including cash transfers, have already begun to flow to people in the below poverty line category. And that's clearly a positive thing. Nevertheless, the economic impact of the pandemic will be deep and prolonged across the board. The slowdown will most impact the vulnerable sections of our population and large swathes of India's next half billion, whom we seek to serve at Omidyar Network India, the vendors, the daily wage earners, the gig economy workers, and small businesses. When Omidyar Network India announced a rapid response window to fund proposals that support the lower 60% of India's income distribution in managing and mitigating the challenges that come with COVID-19, we saw a really strong response from organizations, both for-profit social enterprises, but especially from non-profit organizations. We saw proposals that strengthen containment, detection, and treatment, that support crisis management capabilities, and enhance resilience and recovery in the wake of COVID-19. And it's been heartening to see the number of responses we've received to the call, many of them involving collaborations between groups of organizations that sought to pool their respective strengths. And clearly, this sort of pulling together is going to be really important going forward if we are to pull out of this crisis. While it isn't fully clear yet what the medium and long-term responses will need to be, there are some themes emerging. For example, we see a strong need to focus on informal workers and migrants in cities and to understand what can be done to improve service delivery to them and to improve the quality of their lives in our cities. There is a need to communicate welfare benefits clearly and accurately so that beneficiaries can indeed make use of these programs in real time as their livelihoods are hit. We think philanthropy will need to be quite responsive to these emergent needs, while also supporting all of the work that nonprofits and civil society have been doing, both in response to the crisis as well as before.
First heard about this dreadful COVID-19, I was full of anxiety and was very self-absorbed about the safety of my people whom I love, my family, and myself. And that anxiety even entered my meditation space. But then I started hearing about the plight of migrant workers and how they were walking for miles, not reaching neither their home nor their place of work, how they were starving, dying. And suddenly I felt a great sense of gratitude that my God, how lucky we are, what life they are going through. It was a very sobering experience. And earlier in our philanthropy, we used to believe that we must focus on one thing and do it well. And we decided to spend most of our funds for education. Not only using funds, but we were actively involved with the two NGOs, Akanksha and Teach for India, and spent our time and effort with it. But suddenly we realized that you can't just focus on one cause because all the causes for development are so interrelated and we'll never solve the puzzle unless we look at different causes. So one of the things, we may not even give money, that may not be possible to every cause, but understand it, study it, and do some advocacy. For example, I didn't realize that migrant workers represent 8% of our population. And if you take their families back in the villages, it's almost 25% of people who are living below poverty line. And there are such horrid rules and regulations. For example, their ration card, which they might have got in their village in another state, is not valid in another state. Can we do something about that? In cities, they have to pay 10 rupees to have a Shah and 5 rupees to go to a toilet. Someone like me who needs to go every half an hour might become bankrupt just paying. I'm just joking. But we really don't know about that one. We we were vaguely aware, but we were not touched, not in any way. I think we cannot be so indifferent, and we have to do some advocacy, all of us who care, because how can people in this century live in such dismal conditions? And in the long run, we are not safe unless everyone is safe. We have to realize that. And we sitting in a nice, comfortable home, say they don't follow social distancing, they don't wash their hands. If you're 10 in a tiny room, where is the question of any distancing? When we have one bucket of water for cooking, for everything, how can you wash your hands 20 times a day? So come back to reality. Realize what our people in India are going through with and without COVID, and do something before another COVID comes and hits all of us.
In terms of learnings, I think there have been many. This crisis over the last 8 weeks has certainly tested many of us. But I think there are two that I would like to kind of highlight. One is when the crisis first hit, like everybody else, we were really inundated with calls for support. And I think it left us a little confused initially as to what our response should be, as to what our stand should be. But I think we took the time to pause and to figure out what we were really good at doing, what we could do. And therefore, I think it shaped our response over the coming few weeks in terms of reaching out to each of our organizations and learning from them firsthand as to what needed to get done. And I think that really helped. That shaped our humanitarian approach, to the crisis. The second thing is also about behavior. How should the philanthropic system really behave? And that led to the creation of the common charter, and the common values that we must espouse over this time, not just of flexibility and empathy, but also of partnership, of collaboration, of sharing and communicating. I think that is something that we have learned out of the crisis. Ultimately, I think we want to look back 10 years from now, not only on how much we did, but how we did it. How was our behavior over this period of time? I think that is very, very important. Did we do the very best we could? Did we collaborate as a team? Did we push the boundaries of thinking? Did we create new ways of working with civil society? I think that is really, really important. In terms of what we need to do over the coming months and years, I think this one needs a long-term approach. It's not just post-COVID, but it's just the kind of institutions and policies and systems and structures that the country has built over time. And what really needs to be undone as much as what needs to be built newly. It's very clear that our institutions and our structures did not support the communities that were the most marginalized and the most vulnerable at this time. And therefore, what as philanthropy we need to do around this. The second thing, of course, is really around helping organizations, not just with funding, since there is going to be a funding crunch in the months to come, but also in terms of helping them, give them time and space and support and thinking support around how they would need to reshape themselves after this, how they need to really look at their programs from a more long-term systemic lens, as opposed to just providing support and relief in the communities that they work with. I think that's going to be really important.
Hi, my name is Sunil Wadhwani. I'm involved with two foundations in India. One is the Wish Foundation based in Delhi, which works to strengthen primary care systems in low income communities using innovation and technology. We currently operate over 500 primary care clinics in partnership with government in states like Rajasthan, Madhya Pradesh, Uttar Pradesh, Assam, and Delhi. Over the last 6 years, we've served over 10 million patients with free, high quality primary care. With the advent of COVID, our team is now working double time because we're also helping many of these state governments with setting up COVID crisis response centers, setting up teleconsultation networks so that physicians can connect with their patients but without direct contact. We're helping set up isolation wards in remote rural areas. The other foundation was set up by my brother and myself in Mumbai a couple of years ago, and that's an artificial intelligence institute. And what we do is we apply the power of data science and artificial intelligence to addressing key challenging issues in healthcare, in education, financial inclusion, and so on. So we have teams working on applying AI to tuberculosis, how do we detect TB earlier, how do we treat it better. We're applying AI in areas like better maternal and child health, farming, and so on. With the advent of COVID, we now also have teams working on doing epidemic forecasting for the central government and state governments in India. We have a team working on how to try and detect COVID through the sound of a person's cough into a smartphone. And something like that could truly be applicable globally if you're able to get that to work. What's really impressed me in the last few weeks with the advent of COVID, I mean, this has been an absolute tragedy and it is causing so much misery for so many millions of people. But what's impressed our team is the power of partnering with government in implementing solutions on a large scale, the power of partnering with other like-minded organizations, and finally, the power of innovation and technology in addressing some of these very deep issues. Going forward over the next coming months and years, in both our foundations, we are redoubling our efforts to strengthen the public health system in India. My own dream is that in the next 10 years, by the year 2030, that every citizen of India will have access to good quality primary healthcare. That is the ultimate solution, and that is what will help us avoid and minimize the impact of issues like COVID and any other similar issues. Working together, we can make that vision happen. We must make that vision happen.
Hello, good afternoon. My name is Pradeep and I'm with the Ford Foundation. First off, thank you for providing me this opportunity to interact with all of you. Let me just get to the two questions that was asked of me. First, what are the lessons, I guess, as a philanthropic organization that we have learned from this crisis? Very briefly, two. One is that inequalities, whether they be economic or gender, still need to be addressed and are, in our opinion, a top priority. We have always believed that as a foundation. We have always been focused on it, but this particular crisis has, I think, put some more spotlight on how these inequalities are manifesting in various ways. The second lesson, I guess, is, and this is a lesson that has proved me wrong in some ways. The second lesson, I guess, in a way, is it has shown how philanthropic organizations and even corporates in crisis like this are really can come together and work and quickly act. I was a little cynical about this previously, but this has proved me wrong, and I'm so happy at how these organizations cutting across different priorities have come together to work. What we need, the second question I believe is what will we be focusing on, what we need to do moving forward. For us, again, a couple of things that we are going to focus on. One is, though most of our activities now have been focused on immediate relief, I think at some point of time, hopefully not too far in the future, we all need to focus on the resilience. Resilience can mean different things for different organizations. We as a foundation are asking ourselves, what will it mean for our work and our grantees when we talk about resilience? We still don't have all the answers, but we do know that that's an area that we want to work on. Two, and this is a continuation of the work that we've always been supportive, which is that we do need to build, we do need to focus on institution building. Institution building is key and core to increasing the efficiency of organizations on the ground, be it universities, institutions, non-profits, whatever you have. I think we all need to go back to the drawing board and see, as philanthropic organizations and funders, how can we be better and do a better job of actually helping in institution building. Thank you.
Very strong emotional and mental commitment that this is the right thing to do, and if not now, then when? Right? And that was a very strong and important orientation that we pivoted to very early and very quickly, both at Wipro as well as the foundation. And obviously the might of the foundation is much bigger, at least from the philanthropy side, than Wipro. So that was one. We did that. We decided very quickly. The second is we decided our priorities and our focus very quickly as well. So we said we wanted to focus on two things. Neera, we said we wanted to focus on the humanitarian side, and that was the first and foremost and most important thing to do. And we would try and do that both by providing meals, hot meals, as well as ration, and working with our partner organizations that we trust, and we'd work wherever we could reach the last mile impactfully through their support. And so that's what we've been doing. So, it's an interesting combination because Wipro as a company has leveraged our industrial kitchens that we have on our campuses. We have large campuses that are not being used at the moment. So we have a large campus here in Kodati, which is on Sajapur Road in Bangalore, where we have the ability to produce about 35,000 meals for each meal. And so in 24 to 48 hours, we got that going. And our biggest concern was, look, we can produce these meals. So we're producing about 65,000 meals just from that campus now. We're producing something in Pune and then something in Kolkata as well. But by far, the Bangalore focus is the largest. But our biggest challenge was, hey, look, we can produce these meals. And now they're ready on our campus, but now what do we do, right? How do we now get them? And so fortunately, we were able to find great partners within the government. And I must say the government was incredibly helpful in saying, look, we will pick it up and then we will work with partners to get it down to the last mile. And this has now been about 15 days and I think it's worked really, really well. So that has been one focus on both meals and ration and supporting people. So today we're supporting about 20 lakh people every day. And that number is going up, but that by far is the most important need at the moment, and that's what we are prioritizing in the short term, in the next 30 to 45 days. The second thing is on healthcare, and what can we do on healthcare, which is a much more complex and much more nuanced issue. I've been on a couple of calls with government in the earlier days, and the challenge was figuring out, understanding demand and supply, understanding the availability of supply, understanding where the demand was most, ensuring people are not chasing the same supply. When I'm talking about supply, I'm talking about the classic things, N95 masks, PPE kits, ventilators, all the way from the simplest to the most complex. And it's taken us a bit of time, but over the last few weeks, we've been able to now identify supplies. I think the government is also doing a neat job of matching supply and demand. So people are working off the same data and not sort of at cross purposes with each other. But, we've now gotten to a rhythm where we're going to supply about 50,000 kits every week. We've identified about 20 suppliers, all local, so all in the country. And it's starting to gain momentum. And that's our big focus at the moment. We're also going to identify, we've identified a few, the PCR, the molecular testing equipment. And we're starting off very small. We're starting off with about 10, but we're going to provide them to a few states and maybe that will scale up basis how that works. So that's the other thing that we're looking to do on the healthcare side. And then the third thing is awareness building. I was talking to a civil society organization on Friday, and one of the questions I was asking them is how much are people actually on the last mile aware of what is happening and why it's happening and what you're doing and why you're doing it and why this is important and relevant. And I think we shouldn't take for granted that people understand that, because till people understand it, it's a much more uphill battle. And so we're spending a lot of time on awareness building as well. And that's largely driven by the foundation. On the Wipro side, again, we're trying to use our spaces. And so one of the things that we are doing, and we're just in the middle of it, is we're going to offer to the state of Maharashtra one of our campuses in Pune and offer to set them up a 450-bed isolation hospital, right? And try and do this over the next 4 weeks if that is something that they would like to consider, which we will set up, we will fill it with equipment, we will get a skeletal staff, and then the government can enable, true medical staff to come in and actually run the hospital. So our focus is largely and predominantly on the humanitarian side at the moment, very quickly picking up on the healthcare side. How do we support our civil society organizations and NGO partners that we support, right? I mean, we oftentimes have very high expectations for them in terms of the kind of reporting they give us, in terms of where they can spend, where they cannot spend, in terms of cash flow and how we can support them, then how in many instances we can help them completely pivot. So they could have been in space X and you now require them to be in space Y. And so the objective of that note was simply to encourage people to be supportive. And my request, if any, that I would make to people who are supporting in any capacity, anything, is to really reorient your focus to the crisis at hand, because it is of epic scale and it is very, very, very basic at the moment. And so any support that you can give to reorient your philanthropic efforts, your charitable efforts to the crisis, to the humanitarian crisis, the need is acute over the next 30, 45 days.